Hey everyone, it's Dr. Chappell again, Farmington, Utah, family medicine physician. I wanted to give everyone another update on how things are going out here in the real world. So the biggest update is that myself and some of my staff had recently been exposed to a patient who was positive for COVID-19. Back on the 17th of March, a patient of mine came in for feeling sick for the past 9 or so days. This was the second day that we had been being more diligent of having patients try to stay in their car if they had any symptoms. We had just gotten our protective gear and things like that. However, for this visit, the patient said he just had a simple sinusitis, had come in and did not have any mask put on. We also did not have masks or any personal protective equipment, and did a patient visit. He was here for about 30 minutes. He was not severely ill himself, but later, when he finally was able to get tested, after we kind of went back and forth and his parents tested positive, on the 24th, we learned that he was positive for COVID-19. He had been exposed on March 8th by his parents, who tested positive for COVID-19 about on the 22nd of March. His parents, unfortunately, are elderly and have been hospitalized. His mother's been since released, but his father was intubated on a ventilator and severely ill because of his history of cancer, most likely. From last reports, he is doing better and may make it, but it was very close. So immediately on the 24th, because of this incident, myself and 3 of my staff, my front desk, my MA, and my scribe, all had to go into quarantine and isolation to make it the full 14 days in isolation and make sure we didn't have any symptoms. Luckily, during this time, we were able to be tested, and all 4 of us tested negative for COVID-19. So any of those that were here in my office between the 17th and the 24th that were exposed to myself, even though I was keeping my distance, wearing my mask, washing my hands, and so on, you can rest assured that none of us had COVID-19 and did not transmit it to you. You did not need to be tested unless you were showing any kind of symptom. We obviously clean rooms from that actual patient encounter, the one that had COVID-19, and have done our due diligence there as well. I'm telling you all about this so that you can learn from our experience, so that we don't have to shut down clinics and hospitals and areas of healthcare over and over because of these exposures. The big message is, if you are sick with any form of illness, fever, cough, even a runny nose, or an ear infection or anything, there is that small chance that this is COVID-19 that you've contracted. Please stay home. Do not come into the clinic. And trust me, our business has decreased quite a bit because we're telling people to stay home as well. It's affecting everyone. But we do not want to put at risk ourselves, to take us out of the game, so to speak, for a while, or our patients especially, because we have elderly patients over 65. I have pregnant patients that still need to come in for the regular visits if it's necessary. I have babies and young patients that are at higher risk that need either procedures or refills or vaccinations. And we're trying to do our best to keep the clinic a place for them that will not give them exposure to COVID-19. So if you are sick, we now have telehealth. It's been up and running since our quarantine time, which just ended on the 1st, yesterday, that you can use. And that will allow us to continue to see what we call our healthy sick patients, which would be those that need refills for chronic diseases, the immune compromised, the young babies, my OB patients or obstetrical patients. So here's what you do. If you're sick and you need care, please call our number, the main appointment line, and ask for a telehealth visit with Dr. Chappell. They will get you scheduled and put on the schedule. At the time of your visit, you'll receive a call from our front desk who will set up the telehealth visit, and then I'll get online when it's time, and we'll do it all just like this, over the phone. If there's something we feel like you need to come in for, then we will reschedule you, or we'll find a way to do that. But most of it we can take care of over the phone. And I can order a COVID-19 test that you can have done at the hospital from a telehealth visit over the phone. I've been doing that every day almost. If you're healthy and well, and we need to do your general visits, if you're at high risk, which would be over 65, babies, infants, and children, OB patients, or immune compromised, I want you to come to the clinic in the morning hours, so between 8:30 to 10:30 a.m. Is going to be reserved for high-risk patients. That's when we'll do our lactation visits and so on, because people still need healthcare. We can't just go for months without any of that, because that will cause more hospitalizations and problems. If you don't fall into that category, but you're still healthy, but you need a refill of whatever it might be, of your anxiety medication, ADHD, other chronic diseases, diabetes, not diabetes, but other chronic disease medications, because diabetes would also fall into the immune compromised section. Please come in during the afternoons, maybe the late morning would be fine, or we can try to do a telehealth visit. I am always open to telehealth visits, even though we're not sure if we will be paid for them. It's a safer way to do it. So let's try that. It's all set up. Our telehealth is HIPAA compliant, where no one can hack through and get your health information. It works pretty smoothly over the internet. Sometimes we have to try, several times to re-up the connection, but we're working on that. And you can do it right from your home. That's the way things are going to work here in the next few months, to maybe even longer through this. So that's my message today, is if you're sick, stay home, but contact us via telehealth. The number is 801-397-6080 to call and schedule a telehealth appointment. We are accepting new patients as well. If you're not a current patient of mine, we accept basically all insurances. Thank you.